Good morning, viewer. Welcome to our Fossil TV USA. Here's a breaking news. Yes, what to do if you are experiencing Viagra side effects? For severe side effects from Viagra, stop using the drug immediately and seek medical attention. For more common side effects, talk with your doctors about changing your doses of the drug. Slide is a common medication used to stimulate erections in people with erectile dysfunction. It can also treat pulmonary arterial hypertension, that is called high blood pressure affecting the lungs and hearts. For treating ED, specifically Viagra is the well-known brand name version of this drug. Many factors can influence how long Viagra takes to start working. In general, Viagra takes about 30 minutes to produce noticeable effects. But your diet, your overall health, the medication you are taking, underlying conditions, and much more can all affect the amount of time Viagra takes to work in your body and how long it lasts. An erection happens when nerves in your penis are stimulated. As a result, muscles around two cylinder-shaped chambers of spongy material along your penis, known as the corpora cavernosa, relax and allow blood to flow in, causing an erection. With the ED, your nerves don't communicate properly with your brain and blood does not flow properly into the corpora cavernosa. Taking Viagra relaxes the walls of your blood vessels and lets blood flow more easily into the parts of your penis and that cause an erection. Viagra normally starts working 30 to 60 minutes after you take it in oral tablets form. It may take up to 2 hours to work. Viagra does not work on its own. You will still need to feel sexually aroused to get an erection. Feeling relaxed and comfortable can also help Viagra take effect sooner. On average, Viagra lasts between 2 and 3 hours before its effects start to diminish. Viagra can last up to 5 hours or longer depending on your doses, your body's metabolism, and other external factors. Depending on how your body metabolizes, you may be able to get an erection several times with Viagra in your system. Viagra probably won't make you last longer in bed, though no research has proven definitely that Viagra can increase how long you can have sex. Viagra may not work again immediately after you have had sex. Normally, you cannot get another erection right after ejaculating because your body is not physically prepared for it. This is known as the refractory period. It may only last a few minutes, but it can last as long as a few hours or days. However, a 2000 study found that Viagra may decreases this recovery time. Several important factors can influence how long Viagra lasts for you. The amount of Viagra you take affects how long it stays in your system. The smallest available doses, 25 milligram, that's called 25 mg, won't last as long as the largest available dose, 100 mg. But taking a higher dose is not always recommended as it may not be safe for you. As you get older, your metabolism slows down, so Viagra may last longer as you age. In general, you may notice Viagra works for a longer period when you are 65 or older. Eating a large meal or a lot of high-fat foods right before you take Viagra can keep it from being metabolized quickly or effectively. But this can also make it last longer as it's metabolized along with your meal. Drinking alcohol or smoking can also decrease blood flow to your penis, making Viagra less effective or shorter lasting. Some medication, especially antibiotics such as erythromycin, ciprofloxacin, can interact with Viagra and affect how long it lasts. Certain existing conditions can affect how long Viagra lasts and how well it works for you. Diabetes, nervous system conditions like multiple sclerosis, and heart conditions like fat buildup in your blood vessel can all make Viagra less effective and not last as long. Some kidney conditions may make Viagra last longer because of the condition's effect on your metabolism. psychological state. Feeling anxious, nervous, depressed, or stressed can all influence how your body responds to sexual stimulation. If you are not relaxed or comfortable during sex, or if you have performance anxiety because of past sexual experiences, Viagra may not last long or be fully effective. Viagra usually leaves your system after 2 to 3 hours depending on your metabolism. Viagra can make 5 to 6 hours to fully leave your system. A higher doses will take longer to leave your body. A 25 mg dose may wear off after a couple of hours, but a 100 mg dose may take nearly 4 times as long as to leave your system. Viagra only lasts for a few hours. You won't normally have an erection the entire time, as Viagra is only used to help increase blood flow. If you don't think Viagra is working fast enough, try masturbation or foreplay to help stimulate arousal. If Viagra does not work after 30 minutes, don't take any more than the daily dose that your doctor prescribed. Never take more than 100 mg or Viagra in a 24-hour period. Too much Viagra can cause severe headache, low blood pressure, and orthostatic drop in blood pressure when standing that can lead to fainting. Higher doses can also cause priapism, a painful erection that lasts longer than 4 hours. This can damage penis tissues because blood stored in the penis is not receiving any oxygen. Get emergency treatment right away if this happens. Viagra is not working or is not safe for you. Talk with your doctor about with possible treatment for ED, such as penis pumps, penile implants, intracavernosunal injection, intraoral gels or pellets, exercise therapy, or for anxiety, depression, or other day. Viagra, Cialis, Levitra, and Stendra are oral medication used to treat erectile dysfunction infection. You may also know them by their generic names. About 30 million American men occasionally have a problem with getting or keeping an erection. According to the Urology Care Foundation, when ED becomes a problem, may turn to this oral ED medication. They often help address the tissue. The medication work in similar ways, however, they also have some key differences, such as when you take them, how long they work, and what their side effects are. The side effects of this medication are mostly similar and they are usually mild. Tell your doctor if you have any side effects that linger and do not go away on their own. Below are the most common side effects according to the manufacturers. Side effects: stuffy or runny nose, headache, dizziness, upset stomach, nausea, indigestion, vision changes, rash, flushing, back pain, pain in the limbs, muscle aches, sore throat. So please think about before take the Viagra for your joyness. Bien Das report for Shakti USA.